Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. To all of you sitting out there, I'm sure you've had some type of problem urinating. Not particularly problem, but basically it's a function that we all use daily, if not every few hours and so forth. And of course, things can happen during that period of time with the whole urinary tract that can cause you to go too often or not go at all and things like this, and you seek physician's help and so forth. But today we're going to talk about problems with urinating and then how we keep a good, healthy urinary tract and things like this. Because it's a function that it starts off from a baby. How many babies you know or young children who have problems wetting the bed, bedwetting and so forth. In fact, I had no child of my own. In fact, I used to wet the bed. so basically, and in those days, of course, I wasn't taken to a urologist. I was taken to the family doctor if there was one available, but I can't remember taking any kind of test or anything like that until it stopped on its own, So basically, we have a wonderful doctor here today who has Downstate Medical Center, Brian Keith McNeil, who are going to talk about urology and the functions of the urinary tract. Nice meeting you.
Dr. Deas, pleasure to meet you. Yeah. How you doing today?
Good.
Yeah,
it's good. So good seeing you here. And I just get a little background on you. You've been here at Downstate for just a short period right now, haven't you? Or?
Yes. It's been about 6 months or so since I've been here, but it's been a great experience. I was very excited to come here, and things are coming along great.
Right. When I first saw you, I said, who's this young boy? Because basically you look like you kept your youth going, even although you've been through all the things of training that it takes a urologist to go through. But it seems like it hasn't interfered with your whole look of being pleasant or being that it hasn't been such a hard job, And so, but tell me this now, as a child, where were you raised at?
I actually grew up in Philadelphia, Pennsylvania.
Okay. Went to school there?
Yes, did all of my primary schooling there, and then I made it down to Atlanta to Morehouse for college.
Oh, you're right. That was such a powerful college for our young black boys. And black boys now it's black boys and girls in a sense. I think they have some girls there now, don't they?
Well, at the Morehouse School of Medicine, but Morehouse undergraduate is it's an all-male school.
Yes,
however,
right.
Spelman College is
right there, yeah.
Right there.
Yeah, that's right.
Separated by a parking lot.
Right. Had you had, as a youngster, did you ever have any feeling that you wanted to become a physician? Did anybody influence you, say, in school or in your family or anything like that?
Actually, I was influenced by my community physician. There was a gentleman, Charles Waples, Dr. Charles Waples. He was in the community. He took care of my grandmother, my mother, and even me. So, starting in junior high school, he was a mentor of mine.
That's wonderful. I had a mentor such as that also in Sunday school. His name was Dr. Walter Slade. He was a neurologist right here at Downstate. But he was a Sunday school teacher at Concord Baptist Church where we were in the adult class together.
Oh, wow.
And he would take me after church sometime to the hospital with him.
Okay.
Yeah. But we all have to have that kind of mentoring, don't you think?
I think it's extremement important to have mentoring growing up and just kind of let someone know what the possibilities are.
That's right. And we can use our family doctors as those mentors, but we don't have the family doctors as we used to have them, living in the community. Or you see them on a daily basis or a weekly basis. You might see them at some kind of function or something like that. But I really make it plain that physicians, especially African American physicians, have to be present more than just once a year at a career conference or something like that, and so forth. But now, after leaving Morehouse, what medical school did you went to medical school?
Yes.
Morehouse,
so after
right?
leaving Morehouse, I actually went to the University of Pittsburgh for medical school.
Okay.
And that was just a phenomenal experience, and I had great mentors there as well.
Yeah. Speaking of Pittsburgh, when I finished my degree in public health at the University of Michigan, I was offered a job at United States Steel in their Department of Medicine there. But I didn't take it because I told the director there that I had to really go back to my community, you know, and be there, which I did. And so I didn't take a good paying job and went back to the community. That was 1968.
Well, were you raised here, Dr. Deas?
Yeah, I was raised right in Brooklyn.
Okay.
Yeah, I went to Brooklyn Boys High School, which is known all over the place. You know,
absolutely.
Went to Penn Relays and things like that. Brooklyn College.
Uh-huh.
And then I got a master's at Brooklyn College in biochemistry and went on to get my medical degree right here at Downstate in 1958. I came in 1958.
Okay.
You
Wow.
know, right, as a medical student. But even then, it was only 2 blacks in my class, 2 African Americans, 2 black males. That's all we had.
Uh-huh.
And so now we're striving to increase that number by tenfold. You know, but as you know, it was. I don't know if you had difficulty when you did apply to medical school, but medical school was hard for African Americans to get into. Wasn't it? I don't know if you knew the whole statistics of.
No, I am aware of the statistics, and you know things have changed some, but
Yeah,
there's still work left to be done.
Right. Now going to medical school, how did you choose urology? Maybe you could just give yes. Why did you choose urology? You go through these different clerkships that we have, you know, experiences, but knowing how important urologists are and how few we have in the black community of medicine and so forth, how did you choose urology?
It's actually a funny story. So I started out medical school planning on going into internal medicine and infectious disease.
Right.
However, I spent time doing a surgical subspecialties rotation at the beginning of my 3rd year.
Right.
So I gained exposure to otolaryngology, ENT,
Right.
as some people refer to it. Orthopedic surgery. I had a good time hanging out with the orthopedic surgeons, but I really liked the urologists. I thought that they were just a good group of people. I had fun, and I felt like we were working hard together, doing hard work, and I really enjoyed the surgery.
Oh.
And when I met patients in clinic, it reminded me of my father. I actually lost my father to prostate cancer while I was in high school, and it sort of came out of nowhere.
Wow.
So in interacting with different patients in clinic, I oftentimes thought about my father and, you know, helping other families out.
Yeah, that's quite a thing. I mean, to have that family influence upon you. You know, we all have different influences, of course, you know. But the thing is that when it happens in your family, it really makes a difference. You know.
Absolutely.
I'll tell you, when I came along, there was no family practice residencies, and so I made up my own. So after I finished medical school, my next 4 years was taking 6 months of medicine in each of those 4 years and dividing the other 6 months into subspecialties, you know, to get an idea, because I knew I was going out to practice medicine, and so you had to know some ENT, you had to know some urology, you had to know all these
A little bit of everything.
Ophthalmology,
Yeah.
but a little bit goes a long way, you know, when you're examining a patient. Now, as a urologist, I'd like to maybe just gear out, so maybe we'll start off young and get to the old as such, problems and things like this. Let's start off with just a little bit about bedwetting in children. What should parents be concerned about if bedwetting goes along too far along? What would you think they should be considering to do?
Well, bedwetting is actually common. You know, most children aren't potty trained, so to speak, until they reach the age of 2, 3, sometimes even 4.
Right.
But if it, you know, sort of persists after that, then I think, you know, one should see a pediatric urologist. There are a number of things that we can do to help children out. Bedwetting can just, you know, be because of anxiety, but there are other things. There are actually abnormalities that could result in bedwetting as well.
And that takes special testing, of course.
Yes.
Yeah. But you know, a lot of folks are not aware of these kind of things, and so they'll almost spank the child for wetting.
Yeah, no need to spank the child. Not for that, because there could be an underlying cause.
Oh yeah, surely. And I think that a lot of our folks just get so pent up on the fact that this is just a reaction to something that they can't explain, and so it goes on and on until even a teenage or things like this.
Yeah, absolutely, it can. You know, bedwetting can even be related to constipation.
Okay.
There are some children who are constipated and, you know, they don't have enough fiber in their diet, and if you make that one a modification, you know, their voiding habits could improve tremendously.
I oftentimes, when I used to wet the bed, it always happened in the middle of the night, and I would have to get up myself, not waking up my parents, and change my underwear and things like this. And it was really the evidence of wetting the bed was the target on the mattress. You know, so, but it was kind of embarrassing. And children who have these kind of problems in school, teachers don't recognize they have to go to the bathroom frequently, and they think they just want to get out the classroom or things like that. So even teachers could pick up the fact that a child is having a problem.
Absolutely.
That might be affecting their education.
Absolutely.
You know, yes. Now jumping into, as a child or a baby, circumcision, what's the take on circumcision today? Is it any changes that people are doing, or is it just any group that wants it immediately done with their babies?
There are some, but circumcision isn't medically necessary. There's no medical reason to have a child circumcised.
All right.
I think it surrounds the beliefs of the parents.
Okay.
But, you know, there are some children who choose on their own to get circumcised. And, you know, we circumcise children as old as 8 or 9 or even teenagers.
I see.
But there's no medical reason to have a child circumcised, so to
Right.
speak.
Well, what about male, the adult male? You know, some adult males now are lending to circumcision and things like this when they're having problems in one way or the other.
Yeah, sometimes, you know, adult males get circumcised because they have recurrent infections of their penis.
Okay.
Actually, there's a little, sometimes the head of the penis can become irritated. It's something that we call balanitis. And there are different treatments and whatnot for it, of course, but some men who develop this, if they get circumcised, it goes away.
Right, right, because that is a problem there with the, even upon when they move their bowels, of course, the penis, of course, is low down in the toilet bowl and things like this. And I always talk about flushing. Don't rush to flush. When after a bowel movement, I don't know what your take on this might be, but when you do that great flush, well, let's put it this way: when you had the outhouse, there was no need to flush. When I went down to see my grandmother in Virginia, the only thing I was afraid in the outhouse was a snake in the bottom of that pit. So I had to have eye on two things down there, how far I was going to sit on that bench there in that outhouse, you know. But you didn't have to flush. Now, when that flush takes place and those bacteria, the E. coli and things like that coming out of the toilet itself, there's a whole host of things where that bacteria can affect as far as male and female. What's your feeling about that, or as far as the...
It's a theoretical possibility. And I'm not sure if anyone has done much research to prove or disprove that, but I certainly think that one should rise before they flush.
Yes.
Just to avoid that.
Well, I know, yeah, and you know, the Japanese are making a toilet where you can't flush until you close the toilet seat, and then it flushes, because they have taken areas where the inspection of the air or the flush coming out of the toilet, you know, and things like this. And I was having a patient, well, not just one patient, many patients, female particularly, they have all kinds of problems with the urinary tract infection, and because of the closeness, the proximity of the rectum and the vagina area and things like that, you know. But the main thing I'm concerned about in that is that people should realize that the bacteria can come out that toilet when you do that flush, you know, and things like this. As far as surgery in urology, what is the most common surgery you do today as a urologist? Even before we get to that, let me just mention one other thing. On urinary tract infections in women, how vigorously do you treat it? Is there a diet you put them on? Is there things that they should keep away from when they have frequent urinary tract infection?
Absolutely. It actually depends on the age of the woman, because typically younger women have urinary tract infections for reasons, you know, other than, you know, those that would affect older women. And there are a number of different things that we do. Sometimes it could be a matter of changing your voiding habits. There are some women who we give them a small dose of antibiotics just to sort of prophylax, to prevent any infection.
Right.
And then we also prescribe hormone supplementation, different sorts of estrogen creams.
I see.
Because if the lining of the vagina, over time, it's not as robust as it was.
I see.
And in that situation, a woman has a higher risk of developing a urinary tract infection.
Oh, I see. Okay.
So if all else fails, if you're dealing with someone who has sort of a change in the lining of the vagina, if you supplement them with estrogen, an estrogen cream,
I see.
it can help.
That's very interesting, because I imagine, especially in elderly people, when things become, the structure of the skin and things like that become all different and things like this. And I remember the old thing that folks used to wear black dresses years ago to hide the urine stain on a dress because of the urinary frequency, or the even if they sneezed, urine would come out.
Well, yeah, that's something that I actually deal with a lot. Stress urinary incontinence.
Yes,
you know,
right.
women, both young and a bit older, who experience this. There are various things that we could do for that. Some are surgical, some are non-surgical, as a matter of fact.
Right.
For instance, if a woman has, a few children, and if she delivers them vaginally, the muscles within the pelvis can change over time. They're just like muscles anywhere else in your body.
Right.
So if these muscles change, the floor of the pelvis can weaken a bit. Things can sort of feel like they're falling out. Your bladder could sort of fall out.
Right.
Your uterus can fall out. And all of these things affect the way that you urinate. And by affecting the way that you urinate, they can increase your risk of developing infections.
Yes, surely. What about the exercises? Is there anything, we talk about the floor, when I was in anatomy, the floor of the pelvis was the most difficult dissection, because there's so much in that one little area.
Absolutely.
a lot of little stuff going on in that floor,
Yeah.
And of course, like you say, as you age, that floor can become weak and muscle and things like this. Is there any surgical procedure that you do for this to correct this, other than exercises? Or what type of exercises do you recommend when they are having this due to that?
Well, I think that every urologist has a different approach to dealing with this issue. For me, surgery is a last resort.
Okay.
I will try to do everything in my power before surgery to help someone out. But, I tend to look at surgery as a last resort.
Right.
Some people believe in Kegel exercises.
Which means?
That can sort of help. It's Kegel exercises are sort of the, think about when you're having when you're passing your urine, when you're voiding,
Right.
and something happens and you temporarily stop urinating and then you urinate again.
Right.
Those muscles that you recruit, those are the same muscles that you use when you do Kegel exercises.
I see.
So those can help. I also believe in physical therapy. Just like if you have a sore shoulder or a sore elbow or a sore knee or something like that, or some sort of muscle strain, you do physical therapy. Well, for some women, there's actually pelvic floor physical therapy, which can help rehabilitate those muscles, improve the way that you urinate, and decrease your risk of infection.
Now, regular MDs, when they're treating urinary tract infections, they mention these things you just said. They don't have the knowledge, the full knowledge, because they've never been through urology itself. So they don't get the full feeling of how to instruct a patient, you know? And so it goes on and on, maybe antibiotics, maybe this or that, don't drink here, don't. And at the same time, they don't refer to a urologist, though.
Yeah.
And I think that's, I know your office would be jammed, or the clinic would be jammed if everybody really, because I'm sure there's a large percentage of women that need to know about these kind of exercises and things.
There are, but I think that's one of the great things about Downstate, actually. I have a great relationship with family practitioners and with the internal medicine docs here.
Right.
And oftentimes we discuss these patients together, so we work together to deliver care. You know, I'll be walking down the hallway and someone will pull me to the side and ask me a question.
Yeah, right.
And, I'll do the same thing for them. I don't think you want your urologist taking care of your heart. So,
Definitely,
we work together in concert to take care of patients here. So.
Yeah, well, that's one thing about Downstate, how I enjoyed it, because I had access to all these subspecialties, and I took advantage of them in their lectures, going to the different forums that they've had here and things like this. There's a condition, though, that bothered me when I, as a physician, was the interstitial cystitis, where a person is urinating every 10 minutes with pain. Is there anything, or maybe you could explain it a bit, and is there anything on the market now that they're trying to take care of this kind of condition?
Interstitial cystitis is one of the most controversial topics in urology.
Okay.
And, you know, it's something that's extremely difficult to diagnose because all of these symptoms, the frequent urination, the burning, they can be explained by other things.
Right, yes.
So I think that a urologist has to do his or her due diligence to rule out other causes before stamping someone with the tag of interstitial cystitis.
Right, yes, yes.
You know, and there's various sorts of testing. There's various, you know, behavioral modifications that one has to make. Sometimes we do something called urodynamics.
I see.
And urodynamics is just a complicated way of saying, I'm going to check how your bladder functions.
I see.
So I can measure the pressure in your bladder, the capacity of your bladder, your pelvic floor muscles.
Yes.
I can do all of this to sort of figure out how things are working.
Right, right.
And depending upon the results of this test, we can make modifications, whether it be, you know, changing your habits
Right.
or even medications. There are some medications that help.
Well, you know, I do a lot of newspaper writing and things like this, and I wrote about that particular condition, interstitial cystitis. And a patient got in touch with the newspaper and said, you know, he said, nobody had ever mentioned to me, I've been to all these doctors, she said, I'll never stop reading that column because that was the diagnosis, you know. But the whole thing is that a lot of the, you know, clinics and things like this, sometimes they don't talk enough to people. That people are afraid to talk to them, even if they're having all this pain and urinary frequency and things like this. So I think a good history is always really such an important thing.
It's extremely important. And you know, I think folks, when they go to see their doctors, they should be really honest. No thing is embarrassing,
That's
especially when you're coming to see a urologist.
That's right.
My friends always joke with me all the time. They say, Brian, you just look at private parts and prostates all day. And I'm like, hey, well, nothing is off limits. You know, folks should really go to their doctors, be completely honest, and talk about everything that bothers them, the smallest thing.
Yes.
Because the smallest clue can key us into the diagnosis.
That's right. And certainly, and save a lot of money and a lot of pills and things like this. As far as antibiotics and urinary tract infections, sometimes they'll use an antibiotic that will cover everything, or they think will cover everything. What's your take on using antibiotics in urinary tract infections?
I think that antibiotics should be used sparingly and only when absolutely necessary.
Okay.
For instance, if you have symptoms or if you think you might have an infection, if it's burning when you urinate or something like that, you know, your physician should send a urine specimen and have it cultured.
Right.
Whenever a specimen is cultured, we can identify the bacteria that's causing the antibiotic. And oftentimes we can tell you exactly which medication will work. That way we can tailor what antibiotic you get to your particular bacteria. Because every, you know, medication doesn't work for every bacteria.
Surely.
So it's important to sort of select the appropriate antibiotic for the specific bacteria.
Yeah, because I know, you know, the so many bacteria are not sensitive to so many antibiotics. Like you said, unless it's cultured, you just can't take it and put a blank antibiotic across the board for these kind of things.
Yeah, because you could take an antibiotic for a week, it could be the wrong antibiotic, and you're wondering why you're not getting better, and it's because you're on the wrong antibiotic.
And so many times people have such side effects, all kind of dermatological things with a particular antibiotic and things like this. I used to use azoganthracin when I was
wow.
That's an old
yeah.
The thing is that, and it used to turn the urine red.
Oh, wow, okay.
You know, even, and in fact, I had a patient, you know, people don't know how an antibiotic works. Sometimes they think that whatever you take, it's going to go right down to that particular organ, and that's it, but they don't realize it's going all over the body.
Right, it's going all over.
Right. But this is really wonderful to have you here this day, and we're going to continue our discussion with you on Brian with male problems with the urinary frequency. So I hope that the audience will clue us in, and because you certainly have given an enlightenment to being a urologist, especially a young urologist as such, and how it all happened with your dad having prostate cancer. So we might get into that in the next subject that we're going to be talking about.
Absolutely.
Yeah, but it's so good having you with us.
Hey, pleasure to be here, Dr. Deas.
Yeah, wonderful. So you folks out there, Child wetting the bed, it's important to check out. Having frequency of urine, important to check, because things can happen so fast, and bacteria don't stay in one area. Sometimes get into the bloodstream and cause other problems and things like this. So you want to, take heed to how you toilet yourselves as such, and the way you even wipe yourselves as female persons. Rather than wiping up, sometimes you better wipe down so you don't contaminate that area where the urine is flowing out of, which can lead to the bladder infections and things like this. So we hope that next time you'll cue us in and you'll learn more about that male urological problems. So we'll see you the next time.